Have you ever wondered why some athletes resort to steroids despite the known dangers? It's a question that has perplexed many of us. Let's dive into the reasons behind this perplexing paradox. The world of sports is a high-pressure environment where the difference between success and obscurity can be mere milliseconds or millimeters. In such a scenario, the allure of steroids, promising quick results and amplified performance, can be incredibly tempting. Steroids offer a shortcut to muscle growth and stamina enhancement, which can make the difference between standing on the podium or watching from the sidelines. Moreover, the societal pressure and expectations can often blur the line between right and wrong. The desire to meet these expectations can lead some athletes to a path they would not otherwise choose. Yet the question remains, but are the risks worth the reward? As we delve deeper into the world of steroids, this question becomes all the more crucial. To understand the effects of steroids, we first need to understand what they are and how they work. Steroids, in essence, are synthetic substances similar to the naturally occurring male sex hormone testosterone. They are used in medicine to treat a variety of conditions, from inflammation to autoimmune disorders, and even certain types of cancer. They are potent and powerful, and when used correctly under the supervision of a medical professional, can be life-altering in a positive way. However, the steroids we're discussing today are anabolic steroids, a subgroup often misused for their muscle-building properties. How do they work, you might ask? Well, anabolic steroids promote the growth of skeletal muscle and the development of male sexual characteristics in both males and females. Essentially, these steroids mimic the way real testosterone works, binding to the body's androgen receptors to start producing more muscle. Imagine this. Every cell in your body has a tiny engine called the nucleus. This is where the magic happens. When you introduce anabolic steroids into your system, they head straight for the nuclei in your muscle cells. Once there, they tell these nuclei to start producing more proteins, which your cells use to repair minor damage and grow bigger and stronger. The more nuclei or engines you have, the more proteins you can churn out, and the bigger your muscles grow. But it's not just about muscle growth. Steroids also have anti-inflammatory effects. When your body experiences inflammation, it's essentially your immune system's response to injury or infection. Steroids can reduce this inflammation by decreasing the production of substances that trigger allergic and inflammatory responses in the body. In the medical world, these properties are incredibly useful. They can help patients recover from severe burns, build up strength after surgery, or manage chronic conditions like rheumatoid arthritis. But when they're misused, there can be serious consequences. So, if they have these benefits, why are they harmful? Well, stay tuned, because in the next scene, we'll delve into the dark side of steroids and explore why they can be more destructive than constructive when used incorrectly. Scene script. Here's the catch. Steroids are not without their downsides. You see, beneath the allure of increased muscle mass and enhanced performance, steroids carry a dark undercurrent of potential health hazards. The physical toll they exact on the body can be profound and, in some cases, irreversible. Let's begin with the liver, our body's very own chemical processing plant. Steroids, particularly the oral kind, are notorious for their hepatotoxicity. This means they can cause liver damage, leading to a host of problems like jaundice, liver tumors, and even complete liver failure. Then there's the heart, the powerhouse of our bodies, tirelessly pumping blood to every corner of our system. Steroids can disrupt this crucial organ, increasing the risk of heart disease. They can lead to high blood pressure, alter cholesterol levels, and increase the risk of blood clots. Over time, these factors can contribute to the buildup of plaque in the arteries, a condition known as atherosclerosis, which can lead to heart attacks and strokes. But the havoc steroids wreak isn't limited to these vital organs. They also meddle with the delicate balance of hormones in our bodies. For men, steroid use can lead to a decrease in testicle size, a reduction in sperm count, and even the development of breasts, a condition known as gynecomastia. For women, steroids can result in a deeper voice, increased body hair, and disruptions to the menstrual cycle. And these are just the physical repercussions. The effects of steroids on our bodies are far-reaching and complex, impacting not just our organs but our very biochemistry. They alter the way our bodies work, throwing off the delicate balance that keeps us healthy and functioning optimally. So, while it may be tempting to turn to steroids in the pursuit of larger muscles or better performance, it's crucial to remember the potential cost. Steroids are not a magic solution, and their use can come with a hefty price tag for your health. And it's not just physical health that's at stake. Steroids also take a toll on mental health, and the effects can be devastating. Let's delve into the mental repercussions of steroid use, a topic that is often swept under the rug. When we think of steroids, we often picture bulging muscles and superhuman strength. But beneath this image of physical prowess, a tempest rages. Steroids can cause severe mood swings that range from an invincible feeling of euphoria to debilitating bouts of depression. This roller coaster of emotions isn't just exhausting, it can also strain relationships and disrupt life as we know it. The aggression steroids can stir up is another serious concern. This isn't your typical irritability from a bad day. It's an intense, uncontrollable rage often termed as roid rage. Picture this: minor disagreements erupting into violent arguments, previously calm individuals becoming explosively angry. It's a frightening shift that can lead to harmful consequences. Depression, too, is a significant concern. Steroids can cause a profound melancholy that's more than just feeling down. It's a persistent sadness that can affect every aspect of life, from work to relationships. When the steroid cycle ends, the body struggles to regain hormonal balance, which can plunge individuals into a deep depression. But the mental health risks of steroids don't end there. They also carry a high risk of dependency and addiction. This might seem odd, considering steroids don't provide the kind of high associated with recreational drugs. However, the dependence stems from the body image satisfaction and performance enhancement steroids promise. As users strive for that perfect body or athletic prowess, they can find themselves trapped in a cycle of abuse, unable to stop despite the harm they're causing to their bodies and minds. In short, steroids can wreak havoc on mental health, causing a maelstrom of mood swings, aggression, and depression. They can also lead to a cycle of dependency and addiction, trapping users in a harmful pattern they struggle to break free from. But the damage doesn't stop there. Even after stopping steroid use, the damage can be long-lasting. Now, you might be wondering, what are these long-term consequences? For starters, long-term steroid use can lead to irreversible physical changes. Men may experience things like breast development or shrinking of the testicles. Women might find their voices deepening or their bodies becoming more masculine. Both genders can suffer from severe acne and hair loss. And these aren't just superficial changes. They can have a deep psychological impact, affecting a person's self-esteem and mental health. But the damage doesn't stop at physical changes. Steroids can also wreak havoc on your internal systems. They can increase your risk of heart disease by affecting your cholesterol levels and causing high blood pressure. They can damage your liver, leading to diseases like cirrhosis or liver cancer. Steroids can also alter your body's insulin and glucose levels, putting you at risk for diabetes. And let's not forget about the bones. Steroids can stunt growth in adolescence by closing the growth plates in the long bones. In adults, they can lead to a condition called osteoporosis, which makes your bones weak and brittle. It's important to remember that these effects are not just possibilities. They are realities for many people who have used steroids over long periods. These are serious, life-altering, and sometimes life-threatening conditions. But the consequences of steroid use aren't always physical. They can also lead to mental health issues like mood swings, aggressive behavior, and even suicidal thoughts. And some people may develop a substance use disorder, finding themselves unable to stop using steroids even when they want to. What's worse is that these effects can linger long after you've stopped using steroids. Your body might take years to recover, and some effects might never go away completely. So here's the million-dollar question. So, is it worth it? Is the temporary boost in performance or appearance worth these long-term consequences? The answer is a resounding no. Nothing is worth risking your health and well-being. Remember, there are always healthier and safer ways to achieve your fitness goals. It's clear that the dangers of steroids far outweigh the perceived benefits. With this in mind, it's crucial that we raise awareness about the harms these substances can inflict. Steroids aren't a shortcut to strength and endurance. They're a detour that can lead to long-term health problems, mental distress, and even life-threatening conditions. So, let's change the narrative. Let's talk about the true risks associated with steroids. Let's share stories of those who have been affected, and let's highlight the natural, healthy ways to build strength and endurance. Remember, the journey to fitness is not a sprint, but a marathon, and it's all about patience, perseverance, and dedication. Let's inspire others to make informed choices, to prioritize their health, and to respect their bodies. Because at the end of the day, the body you're building is the one you'll live in for the rest of your life. Remember, your health is your greatest asset. Don't let anything, especially not steroids, compromise it.